Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health Result. My today's topic is bladder neck obstruction. Bladder neck obstructions causes, diagnostic criteria, best effective homeopathy medicines, allopathic mode of treatment, therapeutic. Requested to watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel for further notifications. Let's start with definition. What is bladder neck obstruction? Usually bladder neck is surrounded by the muscles that controls the urinary flow. The muscles, they are tightened up, there is a constriction and they hold urine inside the bladder, and once they are relaxed, so the urine comes out, there is a urination. So this is how this is maintained by the muscles. Due to any abnormality, due to any problem, these muscles gets affected, any obstruction is there post surgery, any damage to that part, so the muscular that controls gets lost. So after that you have either frequent urination, urinary tract infection, so complication arises, left this untreated. So this is how it goes on. Now the causes part, who are at higher risk, happens usually like male as well as in female, but commonly among male, and usually after 50 years of the age. With age this happens. Among men, there are different causes, and the most common cause is prostatic problem. So what is prostate? Prostate is a gland. This is a part of reproductive system, and that usually surrounds your urethra. So if due to any reason there is an enlargement of the prostatic gland, so this compress the urethra. Urethra is the pipe, urine comes out through urethra. So this compress the urethra, and there is a problem in urination. The prostate produce the maximum amount of the semen. So this is a very important gland. Yes, due to enlargement of the prostatic gland, so there are problem in the bladder neck obstruction, and there are other reason like these are surgeries or radiotherapies of the prostatic gland, or for any other reason. If surgery of prostatic gland, or there are radiotherapies, so after surgery, post surgery, there are scar formation, and again there is a obstruction, so urinary problem arises. So these are the common causes among men. Now the women, yes, the the bladder that descend down in the vagina. So this is how, and that can develop due to weak vaginal wall. And why the weak vaginal wall happens? Due to multiple births, multiple deliveries, and there are difficult deliveries, vaginal wall becomes very weak. So for multiple birth, difficult deliveries, or even with age and after menopause. So due to the weakening of the vaginal wall, the bladder drops down in the vagina, and yes, there are again the bladder neck obstruction, and these symptoms arises like urinary problem, frequent urination, UTI. Yes, this happen men as well as in women. Now the symptom part, when you have bladder neck obstruction, symptom also they are very similar in both the cases, men as well as in women. Symptoms are related with your urinary system. The urgency to pass the urine. So there is an urgency. Frequency, you pass urine very frequently. So this urgency you have. There is incomplete voiding or emptying of bladder. You always feel that some urine is remain inside, and if incomplete voiding of the bladder, urine remain inside, so you may have UTI, urinary tract infection. So these can be in the complication part if you left this problem untreated. There can be UTI, urinary infection, burning, painful urination, and the most important symptom is that you lost having control of the urine. So you have to go to pass the urine. There is a poor control to hold the urine. Now the diagnostic part. What are the diagnostic criteria and how we confirm that this is a case of bladder neck obstruction? There are different tests, but yes, the most common one and the very useful test is urodynamics. Urodynamics are the tests that measures your bladder function, your filling of the bladder and emptying of the bladder. And these are usually video urodynamics. And these are done through X-ray and through ultrasound. Detailed images are taken. Your urine is taken out through catheter, and some fluid is inserted, and your filling and emptying of bladder is checked. And is cystoscopy. Cystoscope, an instrument that is inserted in your bladder and checked. Everything is viewed from the inside. So cystoscopy is also done. Depend on your symptom. What complication you may have if you left this problem untreated. Your bladder weak, so you have weak bladder, and there is kidney damage. You may have kidney damage because urine is inside, and you may have frequent UTI, so your kidney may have some damage. So kidney damage, weak bladder, frequent UTIs, and poor control of your urine will be the complication if you left this problem untreated. Treatment in allopathy, treatment in homeopathy. So treatment in allopathy, yes, therapeutic treatment as well as surgical treatment. In therapeutics, you are given certain medication that work on your bladder neck muscles. So you are given muscles that controls your bladder neck. So these are alpha blockers and certain medication given to treat your prostatic problem. Allopathy, yes, medicine treatment, therapeutic, and self-treatment, that is self-catheterization. So you are given catheter, so you can release your urine. These can be temporary catheterization or can be ongoing. Yes, and yes, there are surgical treatment. The patient who they don't respond with the self-catheterization or medication, so there are surgeries, and the common one is TURP, transurethral resection of prostatic gland. So some part of the prostatic gland is taken out, resection of the prostatic gland. If this is enlarged and this is compressing urethra, so that part is taken out. The homeopathic part of treatment. Homeopathic, best effective homeopathy medicine, or we can say individualistic approach or individual medicines according to individual symptom. On YouTube, I have provided medicines link below in description box. You can buy medicine from there and you can start your treatment. These are not the only medicine. There can be other medicine as well depending on your case history. I'm discussing only the couple of medicine. One. So I'm starting with Cantharis. Cantharis is the medicine that is used in homeopathy in treating UTI. So if you're having UTI, you're having bladder neck obstruction and you are having UTI, urinary tract infection, you're having painful urination, burning, itching while urinating. This is the medicine dilution form. If you belong to different part, you may get different form of the medicine, different size and different color. You just go with the medicine name Cantharis given in UTI. So just use, if you are having in the dilution form, 1 or 2 drops 1 or 2 times before having your meal, and use it regularly 2-3 weeks onward till the time you start seeing difference. Next one is Conium Mag. Conium Mag in homeopathy is given treating prostatic problem. And yes, there is an interruption in the urinary flow. You have to start urine and there is a stoppage of the urine. So there is no proper flow of the urine, interruption of the urinary flow. Conium Mag is the choice of remedy. Just take 1 or 2 drops 1 or 2 times before having your meal. Chimaphila is the medicine in homeopathy. Urination, before urination you have to put lot of pressure. There is a straining. You can't even pass the urine without pressure, so you have to put lot of pressure in Chimaphila. 1 or 2 drops 1 or 2 times before having your meal. Clematis erecta is very good choice of the remedy among men when there is a urinary flow is weak, feeble, dribbling of the urine, very weak urine flow. So Bariata Carb is the remedy. In Bariata Carb there is a urgency during night. You have to pass urine multiple times in night. So same 1 or 2 drops 1 or 2 times, and with that you are having prostatic complaint in Bariata. This is the prepared form, general form. This has multiple combination in it. So you can use even this remedy if you are having prostatic enlargement. And this medicine comes in the liquid form. This is the Sabalpentarcan. So just take 10 or 15 drops in some lukewarm water 2 or 3 times in a day before having. Hopefully this video can give you some amount of knowledge. If you find this video knowledgeable and informative, please like, share and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much.